In our today's session, we are going to discuss about the process to work abroad as a registered nurse. For our today's session, we are collaborating with respected Madam Seema. Madam Seema has completed her BSc Nursing from Army College of Nursing, Delhi, and is currently working as a registered nurse in New Zealand. And Madam has 5 years of clinical experience as a registered.
Hi, thank you so much.
So, ma'am, I'd be asking you a few questions, which on behalf of our followers. This question was proposed by our followers through the Instagram. So, can we start, ma'am?
Yeah, you can start it.
So, the first question I would like to ask you, ma'am, is that how were you introduced to nursing? Were you always dreamed to be a nurse, or someone inspired you to take this profession?
Well, I never wanted to be a nurse. I always wanted to be a fashion designer. But my mother, she wanted to be a nurse, and my father wanted to be a lawyer. So I have written like both exams, and I got selected in both. So one was it was the Army Institute of Law in Chandigarh. Other one was Army College of Nursing in Jalandhar. So my parents were arguing. My father wants me to go for law and my mother wants me to go for nursing. So my mother, she's a very caring person and she has always helped everyone. So she said that no, she should go for nursing. And I also thought that, nursing is better than law. And that's how I went to do my nursing. And after that, I started to enjoy it. I started enjoying nursing more when I came to New Zealand. I must say that, because in India, when I don't want to disappoint anyone, I don't want to put anyone down. But when I was doing my nursing in India, I had really nice experiences and unforgettable memories. But to continue working as a nurse, I think it was a bit hard. And most people will agree with me.
Yes,
I had some bad experiences in clinical areas where people will put you down. I remember because I did my nursing from Jalandhar, and when we were in ward, and everyone knows nursing starts with cleaning.
Yes.
So they will treat you really badly. I mean, they look down on you and they will think that, okay, this girl's comes from somewhere, she has no money, she's poor, that's why she's doing this. This is the mentality. So I was put off. It was horrible. Then I thought that I will not work in a hospital. Although I got this letter from a Delhi hospital, I can't remember. It was a good hospital. One was AIMS, other was, I can't remember. So I went to visit my aunt in a small town in Haryana. And I was working in clinical area and teaching the student. And there was this place where they were their prices were low for the studies, and they were trying to help the adults from poor background. So
I think this is because I think there is not much of awareness regarding what nursing is in general public. I guess because whenever when asked to a common person what would they think about nurses, they always say that a nurse is a person who gives injection and medication. Well, nursing is much more than that.
And
so I think this stigmatization is only because there's not much of awareness. And I think if awareness is spread that regarding nursing, what exactly we do, then this type of stigma would be evacuated from the society. That's what I think.
Yeah, I mean, it is actually great. Like what Ashish is doing, what you guys are doing. Yes. I think it will create awareness among the people, and that nurses are not like dummies who will walk around, give you a wash, and just follow the doctor's orders. They have brains. They can do more. They can do research, and sometimes they point out the doctor's mistakes. I mean, yes. And today, like doctors, sometimes they will chart the wrong medication. I have seen it in New Zealand and corrected it a couple of times. But people don't realize that. They think that the doctors are the one, and they still. I remember once we went to a private hospital in Jalandhar, the way they were treating nurses, just paying them like 5,000 rupees, and the nurses were working 12-hour shift.
There's not enough of wages also paid for us. Means the
No,
work we do and the wages we get is not sufficient.
not at all. So yes, and it's not. People should be aware of it. Moreover, government should be helping. They should make something that
Exactly, ma'am.
raise their pays.
Actually, in India, ma'am, the nurse-patient ratio is very is not the ideal nurse-patient ratio. What we think in like there in I am studying in government college, so there are clinicals in our government hospitals only. So we are posted in government hospitals also posted in government hospitals only. So there we can see that in each ward there are like 70 to 80 patients, and only there are like four staff handling over it. This increases the pressure on the staff, and it also somewhat hampers the quality of nursing, and also builds up a mental pressure on the nurse who is working there.
That's right. That's right. I guess that yeah. I don't know how you can take that away, but it will take a long time. But I hope yeah, it will get better. The conditions will get better.
Yeah. So now let's moving on to the next question that I personally would like to ask you, ma'am, is that what is the difference between being a nurse being a nurse in India and being a nurse there in New Zealand? Because you have worked in both the countries. What the difference that you found?
Well, working as a nurse in New Zealand is far, far, far better than working as a nurse in India. And your quality of life. Okay, so first of all, in India, once you will get your registration, you'll have it lifelong. No one will going to check on you. No one will going to see how you are working, if you are like trained in that level or not. And I guess once you have done your BSc nursing, you can go and work in each area, right?
Yes.
But in New Zealand, you need to renew your registration every year.
Every year.
Every year, and they will going to ask you a couple of questions. So here it's mandatory to do 20 hours of education, which is comes under professional development. So each year you need to complete 20 hours of education, which is the place wherever. So the place where you are working, here they provide you continuous training session and education sessions for your continuous development. Then every 3 years you need to do PDRP, so which is Professional Development Recognition Program, and it will give you competencies. So it's hard for me to explain you, but the competencies is like you have to prove and give examples that how you have provided quality of care to this patient, how you have maintained the communication. So you will write that down, and instead of writing a patient's name, you will say Mr. A or use a fake name. And your senior nurse, so the place where you are working, your senior nurse, she will go through, or you have a nurse educator, she will go through it, check that with you, and you have your notes to prove that. So she will check the files and what examples you have written, and she will talk to your colleagues and all of that and make sure you have given the correct example so that you don't lie. And she will go through it, and yeah, then you submit it and you will get a certificate. So you need to do PDRP every 3 years.
Every 3 years.
Every 3 years. And here, if you want to work in mental health, you need to do a postgraduate certificate in mental health. If you want to become a midwife, there is a separate registration for that, and you have to do some more studies. In each area, if you want to work in community, you cannot give like childhood vaccinations. You cannot give childhood vaccinations like you can give in India.
Yes,
Here,
exactly. So
yeah.
there is specialization for everything you do.
Yeah, like before that, I was working in aged care, but recently I've been working in community. I'm working as a practice nurse, so I have to do this study, like this study for 20 hours. Then I have to pass 2 exams, which were like pretty tough, and and then I got my vaccinator certificate. So if I have to give IV, like for IV cannulas, I have to pass a little exam. Each year you have to renew your CPR, which is the resuscitation. So there
Resuscitation.
are there are levels of CPR 1, 2, 3, 4. So 1, 2, 3 are the basics, and level 4 is the advanced one where you can give injection and all of that. So I have done that. So here you need everything, and you will be trained. So each with first aid, you will each year you'll have a first aid training. Does that
Each year.
happen each year? So it doesn't happen in India. So it's a refresher training course. You'll
And
have.
also upgradation, what new things are coming in.
Yes, and they will discuss the old things because it is quite common. You can't remember things all the time, can you? I mean, I can't. So
Yeah.
uh, and I remember when I was a student nurse, everyone. So that's the difference. When I was a student nurse, my principal will come and she will ask me, without looking at medication chart, tell me the medication this person is on. Here, they don't do this to you. They don't bully you for that. Here, tutor will never ask nursing students to remember the medication without looking at medication chart.
Medication chart.
Yeah, here they encourage you to look at it. Here they encourage you, if I have to give vaccination to someone or an injection to someone, or the second difference. So the first difference is your registration. Second difference is your continuous development, which includes the education and all of that training sessions, which does not happen in India, but it happens here.
Year.
Third difference is the communication. Like if you are in India, you are giving someone injection. So will you going to ask them that today, so here you have to tell them, today I'm going to give you vitamin B12 injection. Are you happy with that? Do we
So all the patient bill of rights are followed over there, in
Yeah,
short.
so we don't ask that in India, right? Uh,
Yeah, means
so
patient can ask whatever, because it's his or her right to ask it.
that is. So here the rights. So here health and disability rights. At every workplace, you have the health and disability rights, and the rights of the patients are written there, and everyone has to follow that. So if someone comes to my room, I have to maintain their privacy. No one else. So in India, if you'll go there, I mean, someone is sitting there having an injection, other person is sitting there having an injection. Doctor is discussing about a patient's medical history in front of other doctor. That doesn't happen here. You have to
There is
maintain.
a privacy maintained over there.
Yeah, I mean, I have seen it with my own eyes that doctors used to discuss. Okay, and sometimes how I remember one time there was this old lady, she had chikungunya, and doctor made fun, and he goes like, "Oh, Madam Gunya," and started talking about her medical history in front of 5 other patients because the beds are so close by.
Yeah.
So there is no privacy here. They maintain the privacy, they maintain confidentiality, and your communication is clear. When you are writing your notes, you always write verbal consent obtained from the patient.
Okay.
Once you give the immunization, they have to wait for 20 minutes, and you write it in your notes that patient waited for 20 minutes, when left was fine. So these common things, your documentation is really, really important. So that doesn't happen in India. We don't have that detailed documentation, but
Yeah.
that here. Yeah, so that happens here. So quite a lot of, and the other thing is that major difference. You get paid well here, and you get the respect you deserve for your work. So basically, here we have 8-hour shift, and you get paid hourly. So in India, we get paid monthly.
Monthly, yes.
Yeah. So here we get paid hourly. So you have an hourly rate. You don't have, and if you have a fixed salary as well, you will still have an hourly rate. So if I'm working more than 8 hours, I'll get paid for that ninth hour.
For the ninth hour, for the extra hour you are doing.
Yes, and like in my previous job, I was a coordinator, I was on a salary. So sometimes if I'll do 10 hours, next day I'll finish early to compensate because usually they don't pay you. But if I have to do more than sometimes if I have to do a sixth day, I'll get paid for that sixth day.
Okay.
Yeah, and I remember like once I did 11 hours, but the next day I left early to compensate that.
To compensate that.
Yeah, and I here they encourage you to not to work more than 40 hours a week, but sometimes because it happens and
Yes.
health and safety is maintained here. you get your sick days and your bereavement leave and maternity leave and all other leaves. You get quite a lot of other benefits. If you are stressed, you have an agency, you can ask for some counseling sessions. They provide you free counseling sessions. You can, and the other important thing here, which I'm not sure in India if we have or not, is the nurses organization. So here, every nurse is registered with nurses organization. If you ever have a complaint, you can go to nurses organization, talk to them, try to sort it out, and most of the time they help you. There can be times, where your problem is not solved, but they are there to back you up. So you pay them some like fees every month, and you're covered, your indemnity insurance. If something happens at your workplace, in case your workplace will suspend you, they cannot just suspend you like that. They have to give you a written notice, and they will pay you for that suspension. And then NZNO will be, nurses organization will be involved in there, and they will investigate the matter, that why, what happened, what's the reason of the suspension. You will get a fair trial. It's not that someone will kick you out of your job.
In India also we have nurses organization. Means they nurses have to choose. There are two nurses organization. Nurses have to choose which organization they want to follow. So moving on to the next question, is that what are the different competitive English competitive exams required to work as a registered nurse in foreign countries?
So basically it's IELTS and OET. I have done my IELTS, and I'm not sure about the OET score, but I have heard from quite a lot of people that OET is much easier compared to IELTS. So
and I heard about NCLEX also, like in for USA
I guess,
or Canada, NCLEX.
yeah, so I'm not sure about those countries, so I cannot say anything.
Yeah.
I can say for New Zealand and Australia, they have OET and IELTS. Otherwise, they have different kind of exams. One of my friend went to UK recently from New Zealand, so she cleared. I guess it was NCLEX. I'm not sure which exam was it, but she cleared that.
Yeah. Moving on to the next question, I would like to ask you is, ma'am, uh, what if a person is has completed his or her BSc nursing degree and with 2 years of experience, what exact course he or she should choose in New Zealand to be a RN over there?
So there is only one course. They cannot choose because there is only one course. Okay.
Yeah.
So the course is known as Competency Assessment Program. Please remember it, there is only one course.
One
If
course.
you want to get your registration, few days ago, I also heard from someone that cousin is coming and she's coming here for a health management course to get her registration. And I told that person, you cannot get your registration through health management, infection control, or rehabilitation courses. You can get your registration after passing your competency assessment program.
That's CAT.
Yeah. And you have to contact Nursing Council of New Zealand and fill your application, submit it to them, and then they will going to assess your application. They will going to ask you if they have any question in their mind about your qualification or anything. Then they will give you a letter that you are qualified to do competency assessment program in New Zealand, along with the list of the institutes from where you can do that.
And what if, ma'am, a person has did a diploma in nursing and wants to work over there in New Zealand? What means what he or she should do means,
So
in
if
order
you
to be a registered nurse?
yeah, so if you have done your diploma, you cannot do the competency assessment program straight away, but you can still put your application through uh, nurses Nursing Council of New Zealand, and they will let you know you have to study nursing in New Zealand for 1 or 1.5 years. So you have to do some papers here, and they will let you know what to do.
So, ma'am, competitive competence assessment program is a bridge program.
Sorry, it's a
Is it a bridge program? Means like
what's a breach program? What do you mean by that?
Uh, means bridging course like.
Oh, bridging. Sorry, I heard breach. Sorry. Yeah, it's a bridging course.
Yeah. Ma'am, can you tell us in short about the CAP competitive assessment program in short?
Okay, so CAP program is a 6 weeks program. In this, for 2 weeks, you have your clinical where they will take you through the basic nursing procedures. For example, taking blood pressure, catheterization, all the normal things. And then you'll spend your 4 weeks in the clinical areas. In the clinical areas, you will have a preceptor. Basically, they take the students in rest homes, which is, you can call them rest homes or aged care homes. You will work under the supervision of a registered nurse. Your tutor will come every day. You have to keep a record of what you are doing, and you'll get to learn how you function here. So that's what you do and you will get a list of competencies again, which you need to fill, give it to your tutor. Your tutor will submit it to Nursing Council of New Zealand. Once it has been submitted to them, you will get your registration first. I think it takes 2 to 3 weeks. You will get your registration. After that, you will get your annual practicing certificate. While you are doing your competency assessment program, you have to be with New Zealand Nurses Organization, because here students also need to be with the nurses organization, because you are working on the floor, you're dealing with the patient. So
Patients, yes.
that's why you need to be with the nurses organization.
Okay.
And once
So
you get
what is the
uh,
fees for CAP means a competitive assessment program?
it's roughly not, I can't remember exact, but it's about $7,500.
$7,500. Okay, ma'am. Moving on to the next question, ma'am. Uh,
But
what
different institute have different fees. Most of the institutes, they charge about $7,500.
$7,500?
Yeah.
Moving on to the next question, ma'am, I would like to ask you is the environment safe over there, working environment or the environment for foreign student, is it safe?
Well, like I am safe. Many other people who come here, they are safe. I'll say it's much safer than India. Uh, I haven't, you will have little comments, but it's not the big comments. Like if you want to make an issue out of it, you can make an issue out of it. Here, I used to walk on the roads after finishing my shift at 11 o'clock at night. So, which I can't do in India, which is the truth. I mean, I'll not feel safe, but here I feel safe. You can, if you think someone is following you, you can dial 111 at the same day and they'll be there to help you. So for me, it's safe. And I have seen other people, for them also it's safe.
So, ma'am, moving on to the final question, what would you advise or your tips for people who are appearing or going to appear for IELTS in OET?
Uh, all I'll say is that instead of focusing and paying fancy fees to the institutes, try to do it at home. I mean, you can take some lessons and you will get to know the process. So you can take some papers from them and try to read English newspapers. If you really want to do IELTS, try to speak in English, because once you will move here, language is the important thing. And I have seen with a lot of Indian nurses, they are not so confident when they come after finishing their 6 weeks program. They are not so confident in communicating. Quite a lot of them are good and some of them are not. So communication is your key. So improve that, practice that at home. Try to speak to your friends or colleagues at home in English. And yeah, because you'll be doing your English exam, so watch English movies, speak in English, read English newspapers, improve your vocabulary. You can improve your vocabulary, which is really important.
Yeah. With this, it's a wrap for our today's session. For more information regarding nursing in New Zealand, please subscribe to Madam's YouTube channel. Madam has shared her experiences and also had made a video in depth about the CAP process. So please do subscribe to Madam's YouTube channel, and also you can follow her on Instagram. Her Instagram ID is @NZ and both links for both the both her YouTube channel as well as her Instagram channel is in our description. Thank you, ma'am. Thank you so much for giving us your precious time out of your busy schedule. It means a lot to us, and it was very informative. Thank you so
Oh,
much.
that's